My name's Alissa Olgun, Alissa Olgun. This is California ESL's Grammar Boot Camp, and today we're working on everyday idioms and expressions, and we're starting with idioms and expressions for health and illness. So things like when you go to the doctor, what do you say? So let's start with I have a cough, right? So I have a cough, what do I do? What's the first thing I do? Anyone? I call who? Who do I call? I call the doctor, okay? So I'm gonna go to the doctor, and so I call him and I say, I'm sick, yeah? I need to make an appointment, all right? So I need to make an appointment, and they're going to ask me what? What will they ask you? They're going to ask you for your name. Do you have insurance?
Yes.
Yeah? What's your date of birth? Right?
Yes.
Anything else? The reason why. What are your symptoms? Right? So what are some symptoms we might have? So we said cough already. What else? Temperature or fever? Do you have a fever? They might not say, what is your temperature? But they might say, do you have a fever? Are you hot? And you could tell them, yeah, 104. Bring me in now. What else? What is something else that they will ask you for?
Sneezing.
Are you sneezing? Could it be allergies? Right?
Sore throat.
Sore throat, right? Does your throat hurt? Is it sore? Sore throat.
Sneeze.
Yeah? A lot of these things are allergies. What are allergies? Exactly. A reaction, if you're allergic to it. If you eat something and you have a rash, right? A rash. Or if you get what we call hives or the bumps, right? That's an allergy. Or you sneeze. Yeah, especially during the summertime and the spring when all the flowers come up, right? Okay, so you're going to give them some of these details, probably not everything, and you might go to see your doctor, or you might go to the urgent care, or you might go to the hospital. They might say, if you say, I have a fever of 104 degrees, they're gonna say, emergency room, now. Go.
Where's the difference between?
The difference between emergency and urgent care. Emergency room is for something that is immediate. Usually it's 24 hours open. Most of the time, like the ambulances, that's where they all go. It's a surgical place to do surgeries. It's a larger facility. Urgent care is more like a smaller clinic. They usually are open maybe 9 to 5, or they'll close on 2 or 3 on the weekends. And it's more for simple things like you fall and you have a big cut, and that you can go there and they'll just stitch it, you know? Or, for example, my child fell and hit his head, and I took him to the urgent care. He seemed fine, he just had a bump. You don't need to go to the emergency room for that. If it's something much more serious, you break your arm, or you have a temperature of 104 degrees and you keep vomiting or throwing up, you might want to go to the emergency room, not the urgent care. Yeah? Okay. So I go, they take my temperature, they check my blood pressure, right? They want to check to make sure everything is flowing in my body the right way. They take my blood pressure. What else? They listen to my heart, maybe, to make sure everything, and my lungs, to make sure everything sounds the same, sounds correct. And then they say, what's wrong? Yeah? They will usually ask you for a history, a medical history. So they will ask you, does anyone in your family have heart problems? Or does anyone in your family have a history of cancer. For example, my grandfather died very young of a heart attack. That is something to know, to tell people. Every woman in my family has a medical problem in their throat. So if I have a big swollen throat, the doctors need to know that in my family that's a problem, right? So that's something that's very important. So they'll ask you for your history, yeah? Mm-hmm. And then they'll sort of make a diagnosis. Diagnosis. A diagnosis can tell you what they think is wrong. Yeah? They'll tell you based on your history, based on your symptoms, this is your problem. Okay? What is something that happens after they have a diagnosis?
Some tests you have to do.
Maybe they have to do tests, right? Maybe they will run blood tests.
Throat test.
A throat. We call that a throat culture, but a throat test. Mm-hmm. Maybe a urine test, right? They'll check all of your stuff. This is what's wrong. Here's a prescription. Here's some medicine that will help you. And they'll give you that, and then you can take that to the pharmacy. What's the pharmacy?
Where you can buy the
medicine.
medicine.
Right?
Yes.
Good. The medicine. Okay. So we covered urgent care. We talked about what is an urgent care. We talked about the emergency room. What are some, let's say you have just an everyday problem. You're not sick, but there's just something wrong. Maybe for some reason I cannot see very well. Or maybe my head hurts. Or maybe I have a bump on my skin. What are some types of doctors that you will call and say, hey, I have a problem. I want to make an appointment to come and see you. So let's start with if I have a bump on my skin.
Dermatologist.
The dermatologist. A plastic surgeon also deals with that, but they are for bigger problems. Plastic surgeon will fix my nose and make me look pretty. Yeah? So plastic surgeon will make your nose look pretty. Maybe if you have a very bad burn, they might fix the skin. Yeah? But for a small little thing, you can go to a dermatologist.
Like a mole.
If you have a mole, exactly. If you have like a little dark spot and you're worried. What about my eyes? If I can't see.
Optometrist.
Good. Optometrist. Optometrist. What if I hurt my teeth?
Dentist.
Dentist. What are some other kinds of doctors you know of?
Gynecologist.
A gynecologist, yes.
Orthopedics.
Wait 1 second. A gynecologist is a women's doctor. What was the other one?
Orthopedics.
Orthopedics. An orthopedic. You can go to the orthopedics. That's for your feet. An ortho doctor.
Your arms and feet. Your
Arms and
legs.
feet. Yeah.
How do you call the normal one? Is it a general doctor?
General doctor. General medicine. Or just a plain doctor. It's different from the gynecologist.
Something like pediatric
Mhm.
observation.
Pediatrician. Pediatrician is a children's doctor. An obstetrician is the doctor who deals with pregnancy and labor.
Is he usually
I would say an obstetrician is usually also a gynecologist, but maybe not the other way. Like a gynecologist might be just a gynecologist. Any other doctors you can think of? We named a lot of doctors.
Surgical.
A surgeon. Yeah, a surgeon. A surgeon, maybe a heart surgeon, or an orthopedic surgeon deals with the bones, right? Good. A neurologist. Neurologist deals with your brain.
Can you say that again?
Neurologist.
Neurologist.
Huh? Neurologist. Good. Anything else you can think of? No? I think that's a pretty good list. I think you guys did pretty well.
Cardiologist.
Cardiologist. Heart. Good. Anything else?
Oncology.
Hmm?
Oncologist.
Oncologist deals with cancer, right? Thank you. Good. A men's doctor?
Urology.
Oh yeah. Urologist.
Urologist.
Yeah.
Glad I have some doctors in the room. Why didn't you answer that question?
Don't know.
All right. Any other ones you can think of?
The
No?
doctor of nose.
Ears, nose, and throat doctor.
Yes.
ENT.
An ENT, yeah. Ears, nose, and throat.
Yeah.
Good. All right. Very good. So now you know what information to have, right? If you're not feeling well and you need to call to make an appointment, you know what information to have, your name, your insurance information. You always need to have that. Otherwise, they will make you pay as soon as you go. They won't let you see a doctor unless you pay. So your name, your insurance, your date of birth is very important. That's how they track patients. And then some details on what's wrong. Okay? And you have a very large list of people to call.